Last fall, I announced that Delawareans need to know more about the water they drink and rely on every day. So at that time, we unveiled a new website. It's waterquality.delaware.gov that put many of the state's resources about water in one place. But also, for the first time, it made it easily accessible the annual reports about drinking water quality for public water systems in the state. But I said then that we would need to do more, and that's why we're here today. And today I'm announcing two further initiatives in this area. First is a requirement to test individual private wells when they're drilled or when most homes with private wells are sold. And second, new public access to extensive information about every public water system in the state. For the 82% of Delawareans who are served by public water systems, from cities and towns to the major water companies to small community systems, we ensure that water is tested regularly for an array of potential contaminants. But 146,000 people in our state who rely on their own wells don't have that same assurance. And this stands out as a gap in public health, a gap in the information that people have about their own water, and a potential gap in the information that environmental officials have about potentially serious threats to our water quality, to our groundwater. And what we're proposing today addresses those gaps. So the proposal simply is a requirement that private wells start being tested for many of the same contaminants that public water sources are tested for. While public water is tested quite regularly, the reasonable periods that we are proposing for the private wells are when the well is first dug and when a home with the private well is sold.
We very much believe in the public health rationale for this new requirement. With the information that will be available online through the new Drinking Water Watch, we think this is a tremendous transfer of information from our files to the public. This is the information about the quality of Delaware's public water sources that we in DHSS use to evaluate the safety of water, and that gets reported to the EPA. From now on, the people of Delaware can know exactly what we do about their water. So it's very transparent, just like our drinking water should be.
3 months ago, when we really started focusing on our water data across the state, we very quickly identified that there were some gaps, and that there was a lot of great information contained in the Division of Public Health, a lot of great work going on in DNREC, but there were opportunities to work more closely together, and at the same time, there was some data that we just didn't have. And so today, this announcement is important because, like the governor said, there's almost 18% of Delawareans that really don't have access to good information about their water quality. And so I believe firmly that protecting and improving water quality is among the most critical responsibilities of any government. And like Rita said, this is really both a consumer and a public health and environmental protection initiative. Whether you're served by a public system, a private well, a public well, every Delawarean has a right to know. And we really want to make sure that information is collected and very accessible. And right now, there are no mandated requirements on the water quality from private drinking wells. There might be some additional testing when the well is drilled, but after that, no follow-up. And so that's what we're going to be rectifying.